Hello, my name is Barbara, and I have just nursed my son Matthew, who's 15, through Stevens-Johnson syndrome for the fourth time. He first got it when he was 9, and he had a base of pneumonia and shingles, was given antibiotics. Of course, unbeknown to any of us, the body was heavily compromised, as most of you know that have had associations with Stevens-Johnson's, and of course they gave him stronger, more medication. We ended up in intensive care. No one knew what it was. It wasn't until we actually went to an eye specialist who blurted out in front of this child that of course he would be blind within 6 weeks. Fortunately for him, I was very tired and was even more determined to research this illness, which I have done for years. I'm an advanced diploma herbalist, and I've left no stone unturned. Matthew has an overreaction and kicks off Stevens-Johnson's with ibuprofen, but mostly with chlorine. In layman's terms, the way I explain it is, to my young son, because I believe now he has to take charge of his health. He has to manage his condition. He has to understand that his body is probably about 80-85% inflamed, and therefore he has that small gap between an illness coming on for him than anybody else would. The reason I'm sharing this with you is the pain that he's been through, the horrible lips, the sore tongue, going into his eyes. I have developed a protocol which I sincerely helps some of you. I will tell you what I've done, and obviously it is up to you whether you wish to try it yourself, but I have done everything as naturally as possible, because as again you well know, it's treated, people are treated within the burns unit, and the most they get is saline solution and possibly cortisone. It doesn't help the body to fight, it stabilizes it, but internally, these poor people are starving, and there's no help for the immune to fight. It really is on its own. So 3 things that immediately that you would be able to do if you wish to do what I've done. And again, if you wanted to get in touch with a doctor that would be empathetic to what it is that you want to do, would be very large doses of vitamin C. So if they could be done intravenously, fantastic. If not, what I used to do was crush all the tablets, and any liquid that I gave him, it was through a small hole in his mouth. I had to pull the lips apart to try and keep them apart, because all they wanted to do was heal. And what I actually used for that was Vaseline, and I had 2 like paddle pops, and I would make like a little roll and put it across his lips, because it's petroleum based. Not that I was keen on that, but it did keep the lips apart. I've since found other things that will keep the lips apart, which is fantastic, because that allows you to access putting things into the mouth. And of course, with the tongue being so dry, you've really got to keep liquids off that, because it's like acid for them. So using the syringe, you actually put it over the tongue to the back of the throat, and using high quality liquid minerals, aloe vera, noni juice, goji juice, anything like that. Certainly just purified water, no chemicals, keep them away from anything like that. And vitamin C is your number 1, really assists the body. And watermelon is awesome if you can get that in, strain it. Again, syringe that. It's an anti-inflammatory. It helps with soft tissue repair, and the power of prayer. You cannot underestimate the power of prayer. The first time Matthew got it, as I say, when he was 9, 2 specialists shook their head. They didn't know what it was, and they said they were very sorry they couldn't do any more. It was at that point that I called in a very, very good hands-on healer, spiritual healer, and literally the difference in an hour was huge. I also believe that it was possible, because I do like to be, the devil's advocate, even, with whatever I do, I like to see both sides. He could have possibly been at the healing crisis point, at a turning point, but each time he's had it, I have called in healers, because I truly believe that their energy is just very clean. They're not emotionally attached, and they come in. It's a bit like a jump start on a car, and I'm sure no matter what religion you are, underneath all that you will be spiritual. You will be a loving, caring person who is trying to do the very best for the person that you are looking after. It's imperative that you set goals with this person, whether it be how much liquid you're going to get into them, how much vitamin C you're going to get into them, that you have a plan for when they feel better, because that positivity affects your immune and theirs. It's really important there's no negative talk around these people whatsoever, and that everything is kept comfortable for them. And I just wholly and solely believe in the nutrients. That there's a whole protocol that I use. I just really want to get this video out there. It's December 2012. The first time Matthew had this, he was off for 3 months. This time he's had it, particularly very painful this time. The pain in each root of the tooth, sore throat, cough. A nightmare for a parent, but he's back at school just under 3 weeks, and looks fantastic. Had a blood test done, and 98% looking good. Obviously need to continue with the supplements and begin to put a management plan in, possibly for the rest of his life. But I am a great believer too that if he stays off the sugar and anything white, please do that also. It can be fungus based, but even a virus needs, the sugar to sort of keep it going. So these are the things that I've done. I certainly hope that they help you. Please contact me if you feel I can help you with a few more things. So it's Barbara, and I will post it up at the end of this video, but it's Barbara at emotionalchoices.com. So advanced diploma herbalist. I've been a teacher. I've been lots of things, but I have researched heavily into this subject. Have a lot of information, and there's a lot of products I can recommend. So if you'd like to contact me, I will do my very best for you, and hopefully I can help you. And my heart goes out to you if you're dealing with somebody with this. And I will do everything I can to help you. So all the very best, and you take care of yourself as well as the person suffering. Thank you.